What possible advantage could a company having a proprietary blend provide the consumer? Because if I'm somebody who wants to look at the supplement I'm taking, I'd kind of like to know whether I'm taking 10 milligrams of something or 1,000 milligrams of something. And then I guess some broad red flag categories. So starting broadly here, what are things that people need to be aware of, red flags of supplements, supplement companies, supplement stacks, all those good things?
I guess the first thing to be aware of, and this is a red flag for any supplement, is supplements are actually pretty similar to medications. They have pharmacodynamic effects, pharmacokinetic effects. Pharmacodynamic is the drug's effect on the body. We are fans of mechanism of action, as many of our colleagues and friends are, because when you know the mechanism of action, you are able to know the scientific backing behind the supplement. So past that, another red flag would be taking a supplement for something that you would really need a lifestyle change for. On this podcast, as we like to say, we give you the tools to develop a balanced approach to health. Taking 2 or 3 dozen supplements, perhaps for some people, might be okay if they don't get any pill fatigue in very specific circumstances. But in general, you want to take supplements that have the highest efficacy and least downside. So that could be said for any supplement, but we should probably get into other categories, for example, proprietary blends.
Yeah, so knowing what your specific target is, like you're talking about these people that are taking several dozen supplements, a lot of times they just heard something, started taking it, and they don't necessarily have an indication. Just like you'll see the same thing in polypharmacy when people just get put on medications, and after a while they stop knowing, like, oh, well, I don't know what I take this for. And then doing a medication reconciliation, a lot of times you can eliminate unnecessary medications. And we do a similar thing with supplements. A lot of times we can eliminate unnecessary supplements that people may be spending significant amounts of money on. So I agree with what you said about knowing the sort of scientific basis, how something works, because then not only do you have a stronger foundation of evidence, but you can predict what the side effect potential may be, which oftentimes isn't well studied or documented in the supplement literature. Mm-hmm. So I think that's interesting, but proprietary blends are an interesting one. What possible advantage could a company having a proprietary blend provide the consumer? Because if I'm somebody who wants to look at the supplement I'm taking, I'd kind of like to know whether I'm taking 10 milligrams of something or 1,000 milligrams of something.
Yeah, it's hard to know what the advantage to the consumer would be from a proprietary blend. Even if you're trying to hide it from other companies, someone from another company can take that supplement and have it analyzed, and then they can see what all is in the supplement and what all is not in the supplement. Some companies do post their batch by batch criteria. So they actually test them, and whether it's higher, lower, or the exact same of what is stated, they post that, and you can look it up by buying their supplement and then going to their website and checking your batch number. So that would be an example of a green flag, whereas a red flag would be a proprietary blend where the active ingredient might have an extremely low amount, but you just don't know that.
Yeah, I really like the concept of transparency, whether that is listing out each individual ingredient and how much of it is in the product, or posting, not just saying, hey, we do third-party testing, but actually posting the results of that and tracking it along with the individual supplements, just like there are, pharmaceutical companies where you can plug in your, batch number online, that sort of thing. It's, I guess, much more rigorous quality control. Mm-hmm. And another, I guess, sort of a proprietary blend where you do know what you're taking, but it is a blend of supplements. I see this a lot of times with cleanses or supplement stacks that I kind of alluded to earlier. So, someone goes to a website, maybe their health influencer sends them that way, and you have this, okay, this is your testosterone optimization stack, or this is your gut health stack, or, this is your cognitive stack, and there could be 2 or 3 dozen ingredients just in those few supplements that are part of that stack. So how could you know if that's going to help everyone's gut? Because the more evidence that comes out, it seems like the more complicating the gut microbiome is.
Yeah, individualized medicine, unfortunately, is complicated, and there's a very high demand for it, every individual that's living, and a relatively low supply for it. In general, if there is a special or secret protocol, or there's our friend Derek likes to call them cookie cutter regimens, and it's absolutely true. Cookie cutter regimens often have lots of unforeseen downsides because you're not thinking about the downsides in every individual, and then much less upside than the one person who it really worked well for. Oftentimes, these blends, even if they're not proprietary blends, they have more than 5 ingredients, and they usually worked really well for whatever influencer happened to try it first.
Yeah, I think that's a good way to look at it. So just like there's a lot of people out there doing things that there's a high demand for, the quality of this service is not always particularly high. So there's a lot of interest in supplements. There's a lot of interest in hormone optimization and hormone therapies, but there's not a huge supply of people doing it well. But anytime there is a demand, there are people that are going to try and go in and capitalize on that. So I guess like we talked about, some of the green flags for supplement companies are ones that have been around for a long time. We talked about that on the last episode. Ones that do third-party testing, even better if they post those third-party testing results. Even better if they sell more single ingredient products and not proprietary blends necessarily. And when they do have a multi-ingredient, now aside from perhaps a multivitamin, it doesn't have a laundry list of ingredients.
Yeah. There's kind of a recurring theme that a lot of the green flags and red flags for supplements are also true of medications. So another one would be your healthcare provider or health coach or whoever is recommending this, your influencer, is not making any money, or at least any significant money, off any supplement or medication. That would be a green flag. A red flag would be if they are. Another red flag would be if they are closely affiliated with a company and that affiliation has changed like how they feel about a certain supplement.
Yeah, because at the end of the day, people are going to be able to be incentivized. The saying money makes the world go round. I mean, clearly there are people who have, better or worse morals and ethics when it comes to those sorts of things. So if you see like a 180 in the way that someone approaches supplement, perhaps someone used to be a pro or anti-supplement and now they're very pro-supplement. There may be some underpinning there if there's some financial conflict of interest. Mm-hmm. In an analogy, I just thought, with these supplement stacks, it's like if you look at the general population, most people are overweight, hypertensive, insulin resistant. So should we give all of those people a poly pill? Everyone in the general population, because it would help the majority, right? So let's put some metformin in there. Let's put some Adipex for weight loss. Mm-hmm. Let's put something in there for blood pressure. What else could we put in there? Something to lower cholesterol.
Yeah, statin.
Just put in 5 different medications. And then if you give it to the general population, probably some people will see a dramatically positive shift in their blood work. Mm-hmm. Some people will probably have a host of side effects. Yep. And some people will continue to become more ill if they're not making lifestyle changes. Mm-hmm. Because at the end of the day, a lot of medications are risk reduction or damage mitigation, because we're trying to steer people back towards health. And it's not to say the medications are necessarily bad, but supplements can kind of be thought of as in the same way.